Well, I'd like to thank our panelists. I think the three of these presentations as a set really provide an excellent background that should animate our discussion of points of access interventions, people at risk of harming others to themselves, and what's the best way to think about that? Andy's review, his quantitative review is very helpful, and I appreciate that, and that it's going to be a real valuable tool, I think, for the field. David's trenchant response reminds us both of the value and the limitations that we face in the extant research evidence base, the studies that are out there. And Shannon's very clear presentation explicating this new legal tool is very promising. Is also, I think, an outstanding place for us to start as we think about the fact that you know, if all we're going to do, we say with background checks and better criteria for limiting the opportunity someone has to buy a new firearm from a licensed retailer, and maybe they already have, you know, 6 or 7 guns at home and haven't committed a crime, well, we need other tools to think about how to actually, in a practical way, limit the access that people might have to save lives in those kinds of opportunities. So there's a lot to talk about, and I'd like to go ahead at this time. We've got quite a bit of time left for us to engage questions from the audience or from the panelists, one to another. So why don't we go ahead and start? Put up your little tent if you'd like to ask a question. We could start right here with Fran.
Thank you again. I totally confer with your comments, Jeffrey, about these 3 excellent presentations and the way they fit together and complement one another. I could ask questions of each of you, but I have a question just directly for Dr. Frattarelli. I'm sure you thought about this in the development of this law and certainly in the implementation, but I wonder if you could comment on the possible risk to mostly women, I'm sure, who are petitioning for this restraining order, because as I understand it, women are more at risk when they seek shelter, when they're about to leave the home. Imagining getting myself between a man and his gun, when you think about getting between a man and his car, or a man and his drink, I mean, getting between a man and his gun seems inherently risky in itself. And I wonder what the discussion was, what the implementation criteria might be for helping these women in this situation.
Sure, thank you for the question. So we did think about that, and really what we did look to was some empirical experiences that we have in the domestic violence restraining order field. And certainly that's something that we hear a lot about when we talk about the gun restriction provision of domestic violence restraining orders. I had an opportunity to work with Garen Wintemute, with Daniel Webster a couple years back to look at implementation of the removal of guns in a domestic violence restraining order context in 2 California counties. And we were very cognizant of this risk, and it was specifically removing guns in a domestic violence relationship. And what we found, and this is both from reports from law enforcement who removed the guns, as well as from a small sample of women who were the petitioners in these events, was that they were glad, first of all, that the guns were removed, and none reported increased risk or sort of sense of danger. Again, it was a small sample. That's not to say that that risk isn't something that we should be aware of and concerned about moving forward. But I would also say that if we think about the gun violence restraining order, we're thinking about someone who's in crisis, and if we don't act, they're going to have access to their guns. And sort of what is more dangerous? Is it allowing someone to keep their guns because we're concerned about the removal and what reaction that might prompt, or is there a need to really intervene? And again, based on this limited study that we have with the domestic violence restraining order experience, I think if it's done right, if it's done well, then this is something that we can confidently move forward with.
Thank you. Let's go next to Dr. Huseman over here.
This question is also for Shannon. Let me preface this by saying I've been impressed with some of the laws California has passed, but I'm also a little bit jaded with the experience of Schwarzenegger versus the Electronic Game Association. As you may know, California passed a law forbidding stores to sell violent videos to minors. And they were taken to court by the Electronic Game Association and made it to the Supreme Court. The Supreme Court, except for Justice Breyer, who wrote a very eloquent minority report, ruled it's unconstitutional. So my question is, do you think this law will result in Brown versus, not the Board of Education, but Brown versus the NRA and getting to the Supreme Court?
So again, because this is based on the domestic violence restraining order concept, I think we are in good standing in terms of the legality of this kind of move. I will also say that we have not sort of heard or seen the impassioned reaction from our traditional gun rights voices on this issue. And I think in part it's because the focus really is on two things. First of all, it relates to behaviors. And secondly, it involves putting this decision into the hands of the family. So it's not about big government per se. It's about family members making decisions about what needs to happen in order for family members, their loved ones, to be safe. I can't say for certain that, of course, this won't go to the courts, but, we have a number of strong legal minds who are working on this, and, we're fairly confident, I am fairly confident largely because of those strong legal minds who have looked at this, that this is something that will stand up if the courts do take a look at it. But thanks for raising that.
Thank you. Jim Mercy, you have a question over there?
Thank you. Great panel. I had three quick questions, two for Shannon, and then one for David. Explain to me how this would work in terms of affecting the purchase. I assume that this list of people who have these restraining orders will then be made available to gun dealers, but I'm interested in that. Second, I assume you have plans for evaluating this, and I would be curious to know about that. And David, I'm wondering what odds you would put on the effectiveness of this law, because I have $20 here.
This law?
Yeah.
He has to disaggregate it first.
Gosh, Jim. So your first question, can I? Oh, sorry. Yes, of course. So much like, again, I sound a little bit like a broken record. I apologize. But one of the strengths, I think, of this policy is that it really is built on an existing infrastructure. And so much like the domestic violence restraining order, the idea is that a gun violence restraining order would use that same infrastructure. So when a gun violence restraining order is issued by California starting in 2016, that information would be entered into the background check system so that when a person attempts to purchase a gun, if they have a restraining order against them, that would show up. With regard to evaluation, we're certainly thinking about it. We're excited about looking not only at sort of the outcomes down the line, but the process of implementing this and how that can influence how we understand later evaluation results. We don't have firm plans yet, but it's something that we're very much actively thinking about and working towards. So stay tuned on that. And David.
So I think it depends on the evaluation. And again, how good and how focused it is. It's going to have to be a very focused and good evaluation. One of the things I just should mention is as a researcher, we live in this world where we have out there these two meta-analyses from these august bodies, the CDC and the National Academies, which basically say we do not know if anything works at all or anything doesn't work. That's where we are right now. And what I had hoped that the CDC Foundation would have funded, which they didn't quite, they almost, and then they sort of, it was, let's look at 10 laws and the evaluations of these 10 laws, from stand your ground to concealed carry to whatever, and all these may be under the bar set by the national academies because that bar is incredibly high. But at least it would be able to say, gee, the evidence is, pretty strong here, and it's not very strong here, and it's terrible over here. And that wasn't the charge. Andy did exactly what the charge was. And so I was a little disappointed that we didn't, because that's what I want. I mean, I'm going to have to do this someday, or somebody's going to have to do this. Because there are now a lot of evaluations out there, and there's no good summary of them. And I don't want to see another summary that says, unless you have 3 randomized controlled trials, we don't know anything. And that's what the National Academies basically said, and that's worthless in this world. And so I think we need to get our act together and get a really good summary of what laws, have pretty good evidence and which laws have not so good evidence, as opposed to what laws have incredibly good evidence, and that's going to be none.
If I could just insert a comment here, I see the GVRO law as a kind of a species in the larger genus of what you might call preemptive gun removal or gun seizure laws that the gun violence restraining order in California that we're just talking about. And so we don't, since it's the first one, we don't have evaluation of how that works, and we can speculate. And I would put pretty high odds on your speculations, but just because you're a good speculator. But I would say we do have some experience emerging about the experience of 2 other states with gun removal laws. One is Connecticut and one is Indiana, and our group is doing a study of those 2 laws right now. One of them in Connecticut allows all law officers to get an expedited warrant to remove firearms from people at risk, even if they haven't committed a crime or don't meet criteria to be detained under the state's involuntary commitment law. And the other is in Indiana. A couple points about them is they were both passed in the aftermath of mass shootings with the idea that they would prevent interpersonal violence. And in fact, a lot of the use of these laws is for people with suicide concerns, and which is kind of interesting because if you look at people who might be at risk of suicide, it's a big public health opportunity, as we've heard. Many individuals who are suicidal are not going to be prohibited from purchasing a firearm. And in our new data in Florida that's not published yet, we've identified out of 85,000 people with serious mental illness in the public behavioral health care system in Florida, 50 individuals who completed a suicide with a firearm. Of those 50, 40 of them, if I remember this correctly, were legally able to go purchase a gun at the time. They were not disqualified either on the basis of a mental health adjudication or a crime. So that's a problem with the criteria. 10 of them were legally not able to buy a gun, and they got one anyway. Either they had one at home or something. So that's a problem with the implementation. Those are 2 different kinds of problems that I think highlight perhaps the use of this kind of removal scheme. And another point is that almost all of those individuals, now they're people with serious mental illnesses who are in the treatment system, almost all of them within at least the past 4 to 5 years, and many of them within the year that they completed a suicide with a gun, were detained under Florida's Baker Act and brought in a mental health crisis and did not proceed to a gun disqualifying commitment. So they weren't prohibited from firearms, but if you thought of that as an opportunity to actually maybe remove firearms from people temporarily, that could have saved some of those lives. And there are 50 people, but there are 50 stories, each of which could have, could have a very compelling lesson for us. So let's go to the next question, and I think we have, well, Daniel, let's take you. You have a question.
It's actually a comment I just want to see if Andrew and David would want to respond to. David, I really loved your point about the disaggregation issue. I think it's something we can easily lose sight of. So thanks for raising that. You noted, David, that where the strongest bets are in terms of efficacy of gun laws is where you have very robust, a lot of really strong laws together. And I think what's missing in the literature is when you look at a particular policy, whether it's a domestic violence restraining order or any kind of policy that's directed towards a prohibition for a particular high-risk group, rarely, if ever, do you see an examination of whether the effect of that type of policy depends upon complementary policies that would make common sense. Is there comprehensive background checks, for example? What kind of regulatory structure is there over gun dealers? A range of those kinds of issues, because really, theoretically, for these policies to at least have their biggest impact, you have to have high standards for legal gun ownership, high accountability laws, and then you have to have decent records. And I think rarely does any of those pieces kind of get pulled together, except, David, as you alluded to, there's a few places that seem to have them all together, and they have particularly low rates. One other just comment there. There is a review coming out, David, in March, annual reviews of public health. Karen Wintemute and I will do a review that I think hopefully gets close to what you're looking at. But I don't know if you have any.
Yeah, no, I mean, I guess my comment would be, I agree entirely. It's very hard to do good evaluations, it turns out, particularly, and a lot of things matter. One of the things that's nice for evaluations, horrible for the United States, is that we have so many gun deaths, so you can see some variation. What's hard is that most of the interventions aren't really very large. They're all pretty small, and so it's really hard to see a national effect, or I mean a huge effect on anything. One of the other things I think that really matters too is we sort of think you have a law or you don't have a law, and laws are enforced very differently in different places. In Massachusetts, for example, we have a law that every gun has to be locked up. And as far as I can tell, there's zero enforcement of that law. And so who knows, and we have no idea whether the law has any effect or doesn't have any effect, and it probably may have some effect, but we have no knowledge. And I'm sure it'd have much more effect if there was even a little bit of enforcement.
Thank you. I have a question in the back.
Two questions. In terms of implementation, has there been any consideration as to how someone can get their guns back? Because you mentioned it's about behavior. And just like with restraining orders, people can have those lifted. And then the second question, considerations about people who are from law enforcement or the military, and is there any consideration that they will be treated differently than civilians?
So there is a provision in the law that explains how people can get their guns back after the restraining order is up. And I should say that the California GVRO law is written so that courts can issue this for up to 1 year. So at the conclusion of the year, there's a process that's in place for California, again, that builds on the domestic violence restraining order process, whereby they can request their guns back from the law enforcement agency that has them, and that person essentially has to go through another background check in order to assure that they haven't committed new crimes or been disqualified in some other way during that year that the restraining order has been in effect. So that is part of the law. And again, it's part of the infrastructure that exists. So that's something that won't be completely new to the people of California or the agencies that will be involved. And I'm having a terrible time remembering multiple questions today. Sorry, what was your second question? Military. Right, so there isn't a specific consideration for either of those groups at this point. And there's, I think, good potential for this to be a meaningful intervention for, for returning military folks in particular, where we know that that population is suffering from very, very high rates of suicide. Thank you.
Thank you. Elizabeth Shore.
Relates to your last slide and the exchange you just had with with Daniel. You said that the evidence is clear, stronger gun laws are effective, and it's not clear whether any particular gun law is effective. Now, doesn't that mean that we have to go about figuring out what's working a little differently from the way we have been by assessing individual interventions? And it's not a meta-analysis that is going to solve this. It's a different approach to how we look at combinations of things. And is that happening?
No.
What would it take to make that happen?
One of the things you have to realize is that this is an area where there's not much money, and so there's not nearly as much data or as many studies or as many evaluations or as many meta-evaluations, meta-analyses as you would hope. So it's very hard to do a good analysis of one law. It's much harder to figure out combinations of laws, which ones sort of work together or which ones don't work together. So I think it's just incredibly hard. So I would step back, though, and say I want to make sure people understand that just because there's not really incredibly strong evidence about certain laws doesn't mean we shouldn't support them, doesn't mean they probably work, doesn't mean, there's all sorts of new things. We have no idea whether this new California law is going to work or not, but it makes sense, and so there's a good chance it will work. There's a lot of innovative things we can think about in Massachusetts. I think we just have a new gun law, and one of the innovative things there is that, as far as I know, for the first time ever, we have a gun law that talks a lot about suicide. And there's whole lots of things that are being done about suicide. There's part of the law, every suicide gun is supposed to be traced now, which wasn't before. There's going to be a suicide module in the required gun training course that everybody in Massachusetts, if you want a gun, is going to take. And so there's lots of things that one could do. To answer your question, if you can figure out a really good way to do evaluations differently, because the problem is the N is going to be very small because you just, and so it's going to be really, really hard to do a scientific evaluation. But, as you and I think, both believe, scientific evaluations are not the only evaluations that should matter. There's lots of other things, like if the basic evidence really makes sense, and, there's, as far as I can tell, most of the stuff we do in medicine now, the doctors do, there's no scientific evaluation says this is what you should do, but the common sense and the baseline data and really makes sense that this is the right way to go.
We have a comment from Steve Hargarten, and then to test my peripheral vision here, over here, Sarah Sandlin after that.
Well, actually, I had a question for David Hemingway, but I do have a comment about what he just said about medical practitioners and their advancing science when they're taking care of patients. So, but I'll let that go for afternoon, evening discussion. The question I had, though, David, you mentioned a survey of gun researchers pretty much saying, oh, right, guns in the home and suicide, big time risk. Has there, and I may have missed these surveys, have we reached the public and asked that same question? How much does this research penetrate to the general public for them to say, yes, gun in the home really increased risk of suicide? Or my hypothesis is that it hasn't penetrated the general population.
Well, a large amount of our activities at the Injury Center at Harvard is about trying now, since we believe the evidence is so incredibly strong about this issue, figuring out ways to get more and more people to understand. And we start in all different areas. So we've started to, we've worked a lot with at the state level, the public health people who wrote suicide prevention plans and tried to make sure that they understood that this is right. I think we've done a really good job at the very top. So now all our major groups and all the major suicide groups and all the our plans, our suicide prevention plans for the next 10 years include a really important means matter component. We're working a lot with physicians because physicians don't always get this yet. and psychiatrists and ED docs. We've worked now a lot with gun groups. So now half the gun dealers in New Hampshire have suicide prevention material in their groups. We're trying to work with gun trainers. We want to make sure that gun trainers spend all this time talking about gun accidents, or if they're good, they do that, and that's what, 600 deaths a year, and they spend zero time talking about suicide. Gun suicides are only 19,000 guns per year, and it's like, can't you, isn't this? And now the gun groups are talking about the 11th commandment of gun safety, which is going to be, if someone has going through a big problem and their wife just left them and they're talking crazy and they're drinking, that as friends don't let friends drive drunk, one of the things that a good friend does is to help the gun get the gun out of the house for a while. And that message is resonating. And so, and we do surveys. We're going to do a national survey in January in which we're going to ask what people believe on this. And the answer is it's a slow uptake, but that's really what we're trying to do. And I suspect that most people, that a lot of people still believe that if you really want to kill yourself, you will. And this is, a slow process to try to make it so that people understand. I mean, if you wanted me to say one thing for the new Surgeon General to do, and that is, I think the evidence is so strong that right now, as in 1964, the Surgeon General issued a report that now we know the evidence is so strong that cigarettes cause lung cancer. It's now time to say we know the evidence is so strong that a gun in the home increases the likelihood that someone in the home will die of suicide, because that's the evidence.
Just a quick comment to amplify on a point that David made earlier. If you look at gun law restrictiveness in the aggregate, just look at the Brady campaign scorecard score, there's a strong linear correlation between gun law restrictiveness and firearm fatalities at the state level, in particular suicide. But there's a third variable, and that is the household gun ownership rate. It turns out that correlation is very strong in states that have low household gun ownership. If you look at the states that have lots and lots of households with guns, the correlation kind of goes away because we just can't tell. There aren't that many states that have both a lot of guns and strong laws, so you can't really tell. Now we have a time just very quickly. Could you ask your question, Sarah?
Certainly, and I just wanted to make a brief point of clarification that if there was a discussion about whether or not there should be some sort of a review done, the CDC Foundation was not involved in that discussion. It was not our decision, and we didn't have conversations with the IOM about that. So,
thank you. Daniel, you're going to get the last question. You have your tent still up, or did you mention? You put it down? Okay. All right. Well, thank you once again to our panelists and to all of you in this wonderful audience for your very, very engaged, intelligent questions. I think this has been a really valuable conversation. I'm pleased to have been a part of it. Let's give our panelists a hand. Thank you.